Yo, yo, welcome back, boys and girls. This is Mnemonics, and I'm glad you're coming back for more of my videos. If you haven't been watching my other ones, I suggest you get off your ass and start seeing those. Yeah, so I'm going to continue making some. This is a new one that's coming out. I'm very tickled about this one because it's actually the original idea of what made me start this actual channel. So if you like this video and you like my other ones, click the like button and please subscribe. I think only like 10 subscribers, and that's pretty shitty. And oh, by the way, I swear a lot, so I'm not sorry. And fair warning. So yeah, let's get going on this one. This one's actually really short, so it's not going to be like 30 minutes like my other videos. So you guys can read. Okay, so essentially this is saying, if you have a medical problem, go see a medical professional. I'm kind of a dumbass, so please watch the video. It's a good idea. Even though I'm a dumbass, I still have good ideas. But yeah, if you have a serious medical problem, go see a medical professional and please don't sue my ass. This is self-explanatory. I'm going to swear a shit ton. Okay, so this topic is going to be cranial nerve palsy. So when I was doing anatomy lab in my first and second year of med school, I fucking hated this shit. I had to be really clever as to how can I condense things that are really complicated into like very simple terms. So I have a quick and dirty way to actually do this that should be very beneficial to you if you're in anatomy or if you want to do neurology or what have you, or you're just curious on how this topic works. This actually might tickle your brain just a little bit, pun intended. Okay, so real quick, I'm going to go over some eye muscle anatomy. So I need to preface this up front. This trick only works for the right eye. Do not use it for the left, or else it's not going to make any fucking sense. So keep in mind, see at the bottom here, it says right eye. Okay, so when you're facing somebody, it's their right eye. It's going to be like on your left, but their fucking right eye. I swear, like that gets confusing when I try to teach this to somebody. Please keep in mind, it's the patient's right eye, not yours. It's theirs. Okay, so real quick, I'm just going to talk about which ways the muscles will move the eye. And I'll give a little caveat as to sometimes when that changes, but you'll follow what I'm saying. Okay, so first up, if your eye wants to go down, you have a muscle called inferior rectus. So it's at the bottom of the eye. So surprisingly, it makes it go inferior, which means down. And then the opposite is going to be superior rectus. So there's going to be a muscle on top of the eye that makes you look up. If you want to look towards your side or lateral, away from your nose and more towards your ear, you're going to use your lateral rectus. And if you're pretty clever, you're going to realize the next one is going to be medial, meaning you're going to look towards the middle of your face, meaning middle of your nose. Okay, so there's two more, and these are a little awkward, but just kind of bear with me when I point these out. So you have superior oblique that actually pulls down. So the muscle is actually on top of the eye, and it actually kind of loops back around behind it and pulls it down at a downward angle. It's kind of fucked up, but it'll make sense in a second. And then you have inferior oblique, which is actually towards the bottom of the eye, and it pulls it superiorly. So remember the obliques, just remember for the O means opposite. So if the muscle's on top, which is superior oblique, it actually pulls the eye inferiorly, and then vice versa. So the inferior oblique will actually pull it superiorly. Okay, so now here's the caveat. If you do like a neuro exam or you're doing a clinical practical, depending on the anatomical like isolation you're trying to do, yes, superior oblique does do like a clockwise motion of the right eye, keep that in mind, that goes down and out. But the problem is if you use the inferior and lateral rectus, that can also do it. So to actually isolate it clinically, you have to do down and in, which the arrow would go, I'm gonna use my cursor here. The arrow go from here would actually be pointing this way clinically. So the only reason I'm mentioning this is please don't get pissed at me if you're like, hey, like you told me superior oblique pulls down and out, and then clinically it's down and in. So I just want you to be aware that there's anatomically what you can test and there's clinically what you can test to isolate muscles. So just be aware that there's two different diagrams and you're going to have to memorize both. But this has nothing to do with that. I just wanted you to be aware of that. Okay, so now to the whole point of this video. So the cranial nerves, we're going to talk about 3, 4, and 6. So the first one's 3, and if you don't know Roman numerals, this one is over here, 3 slashes. So it's 1, 2, 3. So if you see that, that means cranial nerve and 3. So it's actually going to be the oculomotor nerve. So ocular meaning your eye, and the motor means moving shit around. So as I mentioned in the previous slide, and don't worry, in the future slide that I have next, it's going to have nice color-coded diagram showing exactly which nerve moves which muscle. So cranial nerve 3 actually does a decent amount of them. So it does medial, inferior, superior, and inferior. And if you knock it out, it's going to have a down and out gaze. And I'll explain what that means in a few slides. So next is cranial nerve 4. So CN is cranial nerve, and then V means 5 in Roman numerals, and then you just do 5 minus 1 is 4. So if you see this kind of setup, that means 4. It's a trochlear nerve, It only does one muscle, which is superior oblique, and if you knock that out, you're going to have a gaze that's going to be up vertically. So lastly is going to be cranial nerve 6. So you take 5, and since it's on the other side of it, you're going to add instead of minus. So you can see how this one's before, this one's after. So this is going to be cranial nerve 6. This is the abducens nerve. So what it's going to do, it's the lateral rectus. It's going to pull your eye outward. So if you knock it out, it's going to do the opposite, and it's going to be stuck adducted, meaning add means together. So it's going to be medial. So I will explain how you're going to memorize this without having to memorize this whole fucking table, because that would be just awful. Okay, so like I promised, here is a, coded diagram so you can see. Cranial nerve 3 is red, so it does a decent amount, it does 4 here. So superior, inferior, inferior oblique, and then medial rectus. Sorry, I had a long day. You're gonna have cranial nerve 4, which is gonna be superior oblique, and then you have cranial nerve 6, which is gonna be blue, which is the lateral rectus. Okay, so let's get down to the whole point of the video. So what you're going to have, and I'm going to pull up the diagram, is that and I'm going to start from 6 down. So over here, things are going to appear. I'm going to go 6, 4, and 3. It just makes it a little bit more easier. We're going to go from simplest to most complicated. So if you're cranial nerve 6, and if you're having like a stroke or a brain bleed or something that's inhibiting the nerve from actually firing, this is what you're going to have here. So cranial nerve 6 is the lateral rectus. So if you were to knock this out, you cannot pull your eye outwards looking towards your ear. So what's going to happen is it's going to get stuck looking inward. So when they make you do, the eye motions during a neuro exam, this right eye, remember, it's the right eye, not the left. Fuck your left eye. It won't be able to move laterally. So what you can do is, to help you memorize what happens when you do have damage to the nerve, well, just use the number. So, sorry, it's a really shitty drawing, but it's the best I could do under the circumstances I had. So what you do is just take the 6 and add an arrow. So if you were to knock out the cranial nerve 6, it's supposed to pull it this way. But if you can't do that, essentially the medial rectus is going to win this tug of war and pull it inward. So that's exactly what's happening here. So if someone showed you this picture and said which nerve is damaged here, if you just use the number 6, you know that the eye is going to be pointed inward. So that's how you know it's 6. All right, so now let's see if we can try to explain the next one, which is going to be cranial nerve 4. So if 4 is a superior oblique and it pulls it down, if you were to knock this out, all these other ones still work. So what it's going to do is just inferior oblique is just going to pull it upwards. So again, if you use the number, it's going to pull it up and inwards. So that's what I drew here. So if you see this eye and you draw this number 4 with the arrow up and it's going up, you know it's cranial nerve 4. Okay, so now for probably the one that's going to be the most common is cranial nerve 3. So if you were to take this and knock all the red ones out, the only 2 left are superior oblique and lateral rectus. So it's going to pull down and then out. And that's exactly what it looks like. So if you use the number 3, it's going to be down and out. And that's what you see here in the right eye. So this really is the key point of how to memorize this. If you can just draw the numbers 6, 4, and 3 and just add the arrows, you'll know exactly where the eyes are supposed to go when you have a deficit with a cranial nerve. That is the whole point of this. So as you can see with abducens nerve, which usually pulls laterally, if you knock that out, it's going to go inward. For number 4, which pulls, essentially down and out, if you knock this out, it's going to pull up and in. And then cranial nerve 3, which essentially does everything in this direction. If you knock all those out, you still have lateral and superior oblique to pull it down and out. So when you see these eyes, you can just match them with the numbers you have here with the arrows. So that's all you have to do. So as a recap, really the main point is what I have in the box here. So this is actually the most important part, is that if you can draw the 3 numbers and just add arrows, you're going to be perfectly fine. And then it'll tell you exactly what's going on with the patient when they show you, they're going to show you a whole bunch of pictures of eyes in different motions. Be like, patient looked left, they looked up, they looked down, they looked right. And they're going to just be dozens of these pictures, and it's actually pretty fucking annoying. But once you find the deficit, you're going to find the one where it doesn't work. And if you just remember the 3 numbers and just remember the arrows, you're going to know exactly which cranial nerve is damaged. And here's just what it says, in totality. I just wanted you guys to at least understand what it says, when you have an issue that's going to be down and out, vertical gaze, and then, adduction. So if you want, I'll get my arrow out of the way so you guys can screenshot this. So yeah, essentially this is the whole point of the whole video. I know this one's really short, but the whole point of this mnemonic is just use the numbers and draw arrows specifically here and for the right eye. It does not work for the left. And again, sorry for the shitty drawings. And that's it. So yeah, I know that was a really quick video, but actually this really was the first concept that I thought was very interesting. And I showed it to somebody in anatomy and they're like, holy shit, that's really awesome. Like you should share that with a lot of people. And well, another way to do it besides YouTube land. So yeah. So if you really like this video, drop down a comment. I mean, shit, if you can come up with a better one, I'd love to hear it. But I seriously doubt it's going to get much easier than drawing 3 numbers and adding arrows to them. Then tells you exactly what's going on with the cranial nerves. But yeah, if you like this video, click the like button. If you want me to make more videos, please tell me, and please subscribe. Um, Honestly, like the more people subscribe, the more it's going to, encourage me to make more videos and actually spit out more content in between my shifts. So yeah, I hope this was helpful and this is a quick one and I'll try to make more videos as fast as I can. I'll shut the fuck up so you guys can get back to studying. So I hope you enjoyed this video and I'll see you guys in the next one. All right, peace.